So once again, I will, so this is Nesrine Barnat's PhD work in collaboration between Théracrion and Institut Langevin. So here we propose to use the EcoPulse HIFU device to occlude the veins. This is not the first time that high-intensity focused ultrasound was proposed to induce occlusion. The only thing is that most of those studies intended to occlude the blood flow in quite small diameter vessels, typically 1 to 1.5 millimeter. And most of the time, the blood flow was decreased, but it was not, they could not induce a permanent occlusion. So our goal was to evaluate the potential of high-intensity focused ultrasound to completely occlude veins with a diameter that was higher than 2 millimeter. We first performed some simulations with the K-wave simulation toolbox to identify the exposure parameters, and you'll see to change a little bit the trajectory in order to ensure to coagulate tissues over a volume that is enough to cover the 2 millimeter diameter of the vein. And then we performed in vivo experiments by using the same device. So with the pulse duration here was a little bit shorter, 4 seconds. And as you will see, we use two kinds of sonications, either fixed pulses or moving pulses. To induce the vascular occlusion, two phenomena might be at stake. First is vein shrinkage, as I explained before, and the second one is thrombus formation within the vein. Vein shrinkage is due to collagen denaturation, and thrombus formation is initiated by endothelial damage. To solve this, we did some tissue modeling and thermal modeling using the Bioit equation. And concerning the damage on the veins, because we do not have the thermal dose, we have it for several tissues, for brain, for muscles, for skin, but not for the vessel walls. But Agea, 20 years ago, actually published a paper where he was looking at vascular damage, typically, and we used his value for actually using the Arrhenius law to predict the damage that we would induce to the vessel wall itself. So we used two sets of pulses, either, so the vein would be along the horizontal axis, and if we use the Théracrion EcoPulse device with 80 watts during 4 seconds, this is the lesions that we would get. So for vessel diameters less than 1 millimeter, it's way enough to cover the entire diameter of the vein, but we wanted to treat veins up to 2 millimeter in diameter, so we might not be able to induce complete coagulation, so that we actually removed the focal point perpendicular to the vein in order to enlarge the thermal effects and cover a larger diameter around the vein. So we performed those experiments with either single focusing, fixed pulse, or moving pulse on 29 rabbits. And here there are two examples of treatments that we performed, either with fixed pulses that were moving, of course, along the vein to treat over a given distance, and other treatments that were performed with moving pulsing. So 8 with moving pulses, 21 with fixed pulses, and we noticed, we were on the learning curve, and the best strategy to induce complete blocking of the blood flow is to compress the vein, to stop the blood, in order to decrease the heat sink effect of the blood and to increase the efficiency of the treatment. This is an example of blood flow reduction. You see a dramatic reduction after the sonications. And here, 15 days after the treatment, you see a complete stop of the flow in this case. So typically, this is the result we got with fixed pulse sonications. We see that a thickening of the wall, and in this case, a complete collapse of the lumen. And in some cases, we could also induce some complete occlusion with a large thrombus within the vein in that case. So not only a collapse, but also a thrombus within the vein. With the fixed pulses, we've been able to completely occlude the veins in 80% of the cases, with the moving pulses in all cases, actually. And the lesson learned is that vein compression is important to ensure a good efficiency of the treatment. When we performed the study, the future work was to translate to clinics, which has been done since, and Michel just presented the results obtained with the same Theracleon device. Thank you for your attention. I thank my collaborators, and once again, Nesrine Barnat, who could not make it today. Thank you.
Question? Yes, please.
So I'd like to ask you about the future when translating to the clinic, because I'm not familiar with that. So if you occlude all the veins, then what happens? You stop blood flow, right?
No, yeah. So I guess Michel could address your question better, but so he was in charge of the clinical trials. That I don't know if you've seen his presentation.
So what we are occluding right now, it's what is occluded already with other thermal methods or surgically, but the other thermal methods are all endovascular. I don't know if you are familiar with a stripping. This means that you are getting with a wire inside the base and you are tearing it out. So the return of the blood is done by a collateral system.
Right.
But this is
getting
rid of the varices, in fact.
Mm-hmm. So it's specific veins. It's not systemic. It's specific veins.
It's just the one that is
only on the veins and only in the lower limb. We didn't went to the vena cava.
Okay. Thank you.
My question is about the thermal simulations. How did you choose the contribution of absorption and scattering for the thermal simulation?
How did you choose what?
Contribution of absorption and scattering for the thermal simulation.
Oh, all those. Well, so first, in that case, so this is almost homogeneous tissue, and we took those values in the literature. I mean, as close as we could get. The thing is, we did not consider in our simulation the blood flow, and actually, it's quite close to most of the most successful treatments that we have had was with the vein compressed. So there was no blood flow. So we just consider basically in the simulation homogeneous tissues, and we look at the thermal rise, and we go well above actually the threshold for coagulation. So it was more for us a way to assess what is the typical size of one single lesion, and do we need to extend this lesion in order to achieve a 2 millimeter in diameter occlusion? And yes, we needed to extend a little bit. But absorption is not from measurements that we did, it's based on the Duck booklet where you have all the thermal and ultrasonic properties of tissues.
One last question.
Just a hypothetical question. What would happen if you use anticoagulation kind of drugs while you're doing the treatment? Will it affect?
But the idea was to perform an ultrasound alone treatment, and no other drugs during the treatment.
But what would
you
happen?
mean if the patient has? I guess this should be.
So maybe I can answer this to you. If you're using anticoagulation, nothing will happen if you are heating the blood, because you are heating it at 85 degrees. What can induce an anticoagulation is the lack of extension of the thrombus at the end of the treatment. And for anticoagulation, if you are doing subcutaneous anticoagulation, you have to do it for 5 days in order to have an effect, and it is in fact used, it's a very good question, it is used for the other thermal ablation methods like radiofrequency, because these are risking to extend the thrombus in the deep system.
All right, thank you very much. Now